Now, you've been doing this for so long, and I wanted to ask you, because it's been since 1997, even before that, you were looking at this. And have you noticed an increase over the years of people with hair loss?
Well, I mean, certainly, my practice has grown over the years. I've treated over 30,000 patients, and year over year, every single year, the practice has grown. And especially in the most recent years since the pandemic, we've seen hair loss exacerbated by stress. Of course, the stress of lockdowns, restrictions, lack of social contact, interruptions in self-care, even just lack of exercise, to be honest, and more toxic behaviors lead to people less able to cope with the stress of daily life. And then you have, some economic issues and other hardships on top of that. There were food supply issues and, getting things delivered by DoorDash and whatnot. People didn't want to go to the supermarket or go out for dinner and things like that. But then also people who were actually infected with COVID-19, suffering from COVID, had the traditional post-febrile telogen effluvium, which is a hair loss shedding due to the cytokine storm, is what we think is related to that. And then now with the vaccines, it really sends people's immune system for a loop. So if they have immune-mediated alopecias, hair loss and such, we're seeing a lot more of that. So I think we're seeing a lot more hair loss, I guess just being accelerated or exacerbated these days, because our level of stress has doubled, tripled, and quadrupled for many folks out there. And they're just simply not taking as good care of themselves mentally and physically as they did perhaps before. So yeah, I'm seeing a lot more hair loss than we did years ago, for sure.
That was my hypothesis, because you just see so many more people in a stressful situation. Of course, the pandemic has made it more stressful, and then just so much more anxiety, which is always a sort of precursor to hair loss.